Hi, I am Vanessa Veras. As I sit here and relax to reflect on my intervention presentation and capsule video reflection, I am mindful of the fact that the contemporary model to the healthcare strives to engage the focus of critical stakeholders such as patients, healthcare professionals, and the public in developing and establishing the quality in the access of healthcare services. However, attaining quality and equal care to all the people, irrespective of racial discrimination, to overcome obstacles towards the change. Ensuring patient satisfaction is a significant focus of any organization, and assessing the degree to which the patients have been satisfied is clinically appropriate. On my capstone reflection, I seek to examine the contribution of my proposed intervention health literacy and cultural competency that address health inequalities against the African American, use peer-reviewed and evidence of literature that I will adopt to plan and execute the Capstone project, and examine the effectiveness of leverage healthcare technology on the project to advance healthcare outcomes and foster communication between and among parties. Besides, the Capstone project addresses the health policies that influence the project's execution and planning project's execution, whether the expectations were enhanced, and my professional development in the project for the RN to BSN program. Today, I can proudly say that I belong to the numerous patient advocates. I have showcased and exhibited satisfactory qualities and characteristics to serve clients and patients with substantial trust and respect. It is worth noting that even the healthcare professionals must have been patients, and hence no one wishes to be treated without respect and quality care services. The healthcare professionals are deemed to possess solid and competent skills to offer imminent care. This is crucial to increase effectiveness, productivity, and ensure absolute patient compliance. Boson 2020. With the ever-changing healthcare system, such as technology access, patients alongside the healthcare professionals must be kept abreast of recent and fundamental training pieces to be in tandem with all compliance policies. Throughout my intervention presentation, I have utterly incorporated effective and sound communication and teamwork among team constituents, which are core in helping to offer imminent care. Essentially, I am conscious that multidisciplinary collaboration is imperative in the continuum of care to the patient. The healthcare facility needs to hold routine meetings and address the downfalls present in the healthcare sector in failure to review and assess regular statistics, facts, and figures. Speed, Lucarelli, and Macaulay, 2018. Any healthcare professional who remains proactive and reactive in his or her routine care can remedy the medication errors and save suitable time for all people across all levels. Individually, I will embrace truthfulness and advocating for the patient, since it is within my passion, character, skills, and expertise to serve and address patients' dynamic needs. Using evidence and peer-reviewed literature to prepare my capstone project often ensure all my presentations follow the correct essay format, which entails introduction, body, and conclusion. Also, I try to much avoid direct quotations in my capstone projects to minimize plagiarism cases, which is the most outstanding academic discipline in today's literacy world. Besides, I organize the capstone's project's contents by topic as opposed by order or author. I consider developing the subheadings to distinguish parts of all my capstone projects. I established a relationship of ideas and pursued flow of ideas in my capstone project. Aims to enhance change and allow creativity to foster the healthcare system are crucial and a potential idea. As a bachelorette nurse, I have come across numerous changes within the healthcare settings that I have worked with. It is worth noting that changes are pertinent in the healthcare organizations and can influence the healthcare organizations either negatively or positively upon implementation. I have also witnessed cases where there is resistance to change in the organization. As resistance to change is a pertinent issue in the contemporary setting, we as healthcare professionals need to examine the differences and analyze them extensively to make a sound decision on whether to adopt them. I have encountered good healthcare policies that have fostered my proposed intervention. The majority of the state's policies, such as the ACA's implementation, have helped to improve and address catastrophic cases of patient imminence and safety. Since the minority groups have been exposed to significant health inequalities, the policies executed to allow them access to good and quality healthcare services. Reading, 2015. Through such policies, I have realized that most African Americans' extreme health cases such as diabetes, hypertension, and cancer have been minimized. The BSN program prepares the nurses in the public service to build and advance their richness for knowledge to increase their level of competency. Nurses who receive superior expertise from a certified university demonstrate proficiency in performing imminent patient care alongside the leadership roles. Typically, the BSN broad experience has prepared me for a leadership model that I have often craved for. Besides, I have developed a collaborative approach quality more proficiently. Fakwa, 2020. Belonging in a team leader for a substantial period, I have gained robust and additional knowledge to become more imminent to attain prolific results alongside offering better, excellent patient care. In general, accomplishing my BSN, particularly at Capella University, was a sound experience. Through the direction and guidance of my instructors, I have been able to explore enough. The instructions of the assignments have been precise and very clear. All the professors helped me significantly. They swiftly evaluated my assessments in less than 2 days with accurate and concise revision instructions for improvements and amendments. I utterly acknowledge my professors for helping me handle my evaluations without challenges, and I can say that I am grateful. Panagiotti in 2018. I can conclusively assert that my professors are the best in delivering the knowledge and ensuring the knowledge is delivered effectively. In summation, reflecting on my intervention, presentation, and capstone video reflection has allowed me to become a contemporary model to healthcare that often strives to engage the focus of critical stakeholders such as the patients, healthcare professionals, and the public in developing and establishing the quality and the access of healthcare services. I have showcased and exhibited adequate attributes and characteristics to serve clients and patients with substantial trust and respect. The majority of the state's policies, such as the ACA's implementations, have helped to improve and address catastrophic cases of patient imminence and safety. Since the minority groups have been exposed to significant health inequalities, the policies were executed to access excellent and quality healthcare services. I utterly acknowledge my professors for helping me handle my evaluations without challenges, and I can say that I am grateful. I can conclusively assert that my professors are the best in delivering the knowledge and ensuring that the knowledge is delivered effectively. Thank you for this amazing experience.